Health Chat is sponsored by Buell Regional Health Foundation.
Nutrition is important. It's a choice we make every day. It's important to choose your lifestyle accordingly, as well as what you put into your body. Think of food as your fuel, as if you're a car. Are you choosing good quality, high nutritious food, or are you choosing, say, cheap and easy? We all make choices every day. It's important to maintain a healthy diet over the holidays, as to thoroughly enjoy yourself, but not to overindulge. When our weight fluctuates over the holidays, we often become really hard on ourselves. Maintaining your weight through the holidays is important because we do not want to focus on New Year's resolutions as being the only time of the year that we need to focus on weight loss or weight maintenance. We should focus on that year-round. Moderation is key. We should not necessarily overindulge, but I think we all do. We're all human. We have that nature about us. But being more consistent day in, day out, and then looking for those holidays, looking for those gatherings to really enjoy our family, friends, and loved ones rather than focusing on the foods or maybe not focusing on the foods. We just want to enjoy ourselves over the holidays. We should balance healthy eating over the holidays by planning ahead. For instance, if we're getting together as a family in the afternoon, I would strongly encourage you to eat something in the morning before leaving your residence and going to a family or friend's house. When we skip meals to plan for maybe overindulging at those gatherings, we truly do overindulge. Even having a small snack, something of a complex carbohydrate, say whole wheat grain toast with some peanut butter on it, having a slice of cheese, maybe with some apple slices, something small. That way you don't overindulge immediately when you get to those family gatherings. Depending on your lifestyle choices or say your medical conditions, we can all enjoy sweets in moderation. I would advocate, say, instead of having brownies or devil's food cake, maybe have angel food cake. Also planning ahead, could you bring fresh fruits and vegetables with a yogurt dip to these gatherings? Could you bring ginger snap cookies? Some examples that you can apply when you're cooking and baking through the holidays. Substitute applesauce for oil, margarine, and some baked goods. Reduce the amount of butter. You can use Greek yogurt in place of sour cream and sauces and dips. Instead of unsweetened baking chocolate, you can use 3 tablespoons of unsweetened cocoa powder with 1 tablespoon of margarine or butter. Of course, choosing margarine that does not contain trans fat. There are many different types of oils available that we can choose to use in our baking and cooking methods. The main one I'm hearing more and more about, and I'm encouraging patients and friends alike to use, would be coconut oil. Although it kind of falls into a gray area as it is considered a saturated fat, and saturated fat we should consume in moderation and lower amounts. But the coconut oil is higher in omega-6 fatty acids, which we can benefit from having. Other oils would be olive oil, sesame seed oil, avocado oil. These are becoming more readily available, more cost-effective in our marketplace. Those are additional oils I would recommend. There are 2 types of fats, unsaturated and saturated fat. Saturated fat is often solid at room temperature, whereas unsaturated fat is liquid at room temperature. We want to encourage intake of unsaturated fat in our diets. It's a main focus of like a Mediterranean diet, having more olive oil available. They're often more heart healthy, and we should be consuming them in larger quantities. There is a 3rd type of fat, it's sneaky in our diet. It's called trans fat. It's a chemically made fat. We should really focus on not consuming any trans fat. Technically, our government dictates using our nutrition fact labels that we can consume some. The rule of thumb is we should always consume less than 2 grams, but ultimately none is better than any at all. So what is sugar? Sugar can be considered cane sugar or it can be a natural sugar, say, as part of a component of, say, an apple. In our diets as Americans, we often get focused on reading nutrition fact labels where we focus on added sugars. I would encourage you to be cautious of consuming foods that have added sugar, as it often is a maltodextrin or it is cane sugar. So that would contain extra unnecessary or empty calories. In our diets as Americans, we should really focus on more complex carbohydrates, whole foods. So foods that would be naturally sweet would be more of our fruits, but even say things like our dairy or some of our vegetables would still also contain sugars. So what is a portion size? A portion size would be the quantity of food that you're eating at a sitting. Healthy portion sizes are often dictated by our wrist size or our fist size. For instance, a serving of a lean protein should be about the size of the palm of your hand, or a deck of cards. I like to encourage patients and friends alike that half of their plate should be some type of fruit or vegetable, rather than focus on, say, pasta, bread, other heavier, more simple carbohydrates. At the holidays, if you can focus on more broth-based soups, or say doing a side salad before or after your meal, that way you're filling yourself up. When you have things that are, say, higher in carbohydrates, a cream-based soup, there's often lots of extra calories associated with that milk, higher fat dairy product. You can still make good choices over the holidays, stay positive, stay optimistic, eat well, live well.